Good morning.
Morning.
So I hope you've all had your coffee. We're going to do a little bit of a history, but first I want to thank Seven Mountains EMS Council for letting me come and talk about one of, it was a historic event, a historic success. We are not done. It doesn't solve all our issues, but I am very grateful that I get the opportunity to come and actually talk about this medical assistance increase. So as Kathy had reached out to me and I started thinking about what I was going to talk about, I happened to say to her, how much time do I have? Because I started down a little bit of a rabbit hole, which you'll understand as I go through. So I have 30 minutes. I do not have a timer. Tim has a stick that he will probably hit me on the head with if I go too long. But so we're going to have a little bit of a history lesson. So my first question is, does anybody know when DHS, DPW at the time, first started paying EMS? Any guesses? Okay. It was 1978 or 1979. The Department of Public Welfare, Medical Assistance, the Office of Medical Assistance Program, starts to pay EMS $20 per transport, $30 if you were VASC certified. Does anybody know what VASC stands for?
Mm-hmm.
What's it stand for? Come up here, you're gonna get this anyway. Come up here, come up here. No, you don't want it? I will hand it to you. All right, so VASC stands for Volunteer Ambulance Service Certification. This predates Act 45 of 1985, so that tells you how far back it goes. So, the EMS Act, prior to 1985, and when the Act came into being, the VASC services were basic life support ambulance services that were VASC certified upon the effective date of the rules and regs, blah, 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 blah. So basically it was the certification before we were officially certified through the Bureau of EMS, which was an office of EMS at the time. So, does anybody know when the AAP was founded? I'm stumping the panel, I like it. 1986. 1986. So when the AAP was founded, it was to make the reimbursement, the world of EMS a little bit more palatable. And we wanted the reimbursement to be a little bit more effective. So our first success was in 1990. And so BLS was taken up to $60 and ALS was taken up to $120. So think about the 1990s, what that did. So the medical assistants also paid port to port minus 20 miles. And so they considered that 20 miles to be the cost of doing business. So in 2004, there was a lawsuit filed and the AAP was part of that. And I don't know if anybody remembers Mike Markolinsky from Ford City Ambulance, but may he rest in peace. He was on the forefront of this saying it was unfair, medical assistance wasn't paying enough. So the details for that, because it was prior to me, because I came along in 2006, they were successful and gained the attention of the Department of Public Welfare. It took BLS up to $120, ALS up to $200, and it ended up being $2 per mile port to port again. So since 2004, and when I came along in 2006, we have had numerous meetings. I can't tell you how many times we have met with the Department of Human Services. They do not want to do anything until there is an access to care issue. And of course, we all know how EMS works. You call 911 and you get EMS mobile ER. We'll get into that. So, they would not look at the rates. They would not talk to us until there was that access to care issue. And then comes along 2014. So in 2014, they changed the mileage reimbursement. And they changed it from port to port minus 20 to loaded miles minus 20. So basically they took away that reimbursement for mileage completely. This was issued in a Pennsylvania bulletin that was the last Saturday of the last day of the year when everybody is on vacation, getting ready for the holidays, getting ready for the new year. And we caught it, I think it was probably like January 4th or 5th. And so then we had Representative Barrar at the time schedule a meeting with Secretary Ted Dallas, who was Secretary of DPW at the time. And he basically said to us, find me the money. And we were like, wait a second, you just took it from us. Why can't you just give it back to us? Turns out there was a state plan amendment that was filed that we didn't know anything about. CMS had to approve it. They saw loaded miles. CMS requires loaded miles to be paid. So they said, okay. We said, not okay, not okay. We did request information through the Right to Know office on how the state plan amendment was filed, what CMS's response was, and basically that's how we found out that CMS would pay for all loaded miles. So does anyone know when the next increase was?
2021.
Yeah.
Nope, it was before that.
2018.
2018, who said that? Come here, come here, come here, come here. That's I finally got someone who guessed it, thank you. All right, so in 2018, members of the Ambulance Association expressed their frustration over the lack of attention and reimbursement from DHS. The AAP worked with Representative Kauser, who has been an EMS manager. He understands EMS. He is also an EMS provider who just got his National Registry certification. We held a press conference at the Capitol. We had many calls to action, many legislative meetings with staff, and all these things kind of go on behind the scenes. And as I was kind of thinking about how this all came about, that's when I started down this rabbit hole, which is why I'm asking all these questions. So after that, the press conference, BLS went up from 120 to 180, and the ALS went from 180 to 300. It was still $22 a mile for all loaded miles, minus 20. We could not get them to change the mileage. And Air Ambulance had a huge bump that year, and they hired high-priced lobbyists to get that increase. You're looking at, and Don Doremus from Suburban EMS, he's my legislative committee chair. Chuck Cressley, who I'm sure many of you know, he has since retired, but he's still involved in EMS. And then the president was Dean Mollendorf at the time. Gary Waters is now president. So the 3 or 4 of us do spend a lot of time educating the legislators and legislative staff on those issues. We did not hire a high-priced lobbyist. So, in December 22nd of 2018, so that December date is very important. They took away our mileage in 2014 at the end of December. The increase that was effective January 1st of 2019 was issued, the Pennsylvania Bulletin was issued in December of 2018. So, there had been 40 years from the time DHS started paying EMS till we got our 3rd increase. We had 2 increases in 40 years. That is sad, but it was one of our talking points with the legislators, which helped our case. So does anyone know when the next increase was? Somebody said it. 2021? 2022. Representative Kauser held another press conference, and it was on First Responders Plaza. We had 2 ambulances that were parked there. We put price tags on everything so that the legislators and the legislative staff could see actually how much it costs. We had some providers that had tags that said this is what their salary is. So we wanted to give the press the opportunity to advertise that. We had legislative staff there, we had legislators there, and so we were able to take BLS up to $325, ALS to $400, and mileage went up to $4 a mile, loaded minus 20. So we're getting this increase, but we're still not getting reimbursed for the mileage. And Air got nothing that time. So even though I have a lot of papers, it's like all back up for me. And it needs to be big so I can see it. So, when was the next increase? 2023, who said that? All right, come here. All right, you'll get one later too. There had been a huge turnover in the House. We lost a lot of our champions and people who understood what EMS was. So Representative Bennyhoff, whom you all know, he was in leadership. He has since relinquished that position. He was no longer in leadership. We had several other legislators who also retired. So there was a lot of education that we had to do. So there was several pieces of legislation. Representative Borowski, who was a freshman legislator from the Southeast, she introduced a piece of legislation that would have been loaded miles, all would have been paid. Senator Brooks on the Senate side had a bill that would have paid for all loaded miles -5. So Senator Brooks was agreeable to amending it so that it would be all loaded miles. So we were looking at both the House and the Senate to help us get where we needed to be. In the meantime, when it was passed in the House, Representative Borowski's bill went over to the Senate, and if anybody understands, and I know the legislators, they all understand this, but it has to be approved in the House, it has to be approved in the Senate. It got amended in the Senate, so it had to come back to the House to be approved. When it was amended in the Senate, it had all loaded miles, plus it had a Medicaid increase for us. When it came back to the House, it went to rules. Unfortunately, it had the budget attached to it, and there were some issues with school vouchers and the governor, and so our issues are all nonpartisan. I don't know if you want to call it bipartisan. We transcend politics. However, this piece of legislation ended up being part of the political process, and it went to Rules Committee. We sent a call to action out to all our members. Please contact your legislator, ask them to talk to leadership in the House, bring it out. It didn't happen. So then there was a second piece of legislation that was also amended with the budget. It also had all loaded miles plus our Medicaid increase. It also did not make it anywhere in the House. Third time's the charm. Senator Pittman amended a bill, House Bill 1300. It came back over to the House, it was approved. Yay, the governor signed it. Yay, we get a medical assistance increase. It pays for all loaded miles and the greater of the two, Medicaid or Medicare. Yay, you think, fabulous, it takes effect January 1st of 2024. Yay, wrong. We reached out to DHS. We said, we want to work with you. We want to make sure that this information is correct. And they said, well, this only applies to mileage. You're just going to start getting paid for all miles. No, it's the greater of the two. It is also the base rate. So we ended up having meetings with them. We met with DHS and IT because they wanted to know how Medicare took care of what's rural, what's super rural, what's urban. It started to get pretty complicated. December the 13th, we met with DHS. Several people, the Medicare, the managed care programs, program integrity, and we talked to them about this. And they said it was going to be published in the Pennsylvania Bulletin, and it was published December 29th. There's that December date again, the last day of the last Friday of the year. And so we looked at it right away, and the numbers were low. So they were incorrect. They were too low, and there was no non-emergent codes, which would have included A0426, A042, and A0428. So we reached out to them, and they said, okay, we need to discuss this. And they also told us that the mileage needed to be included in a state plan amendment. And so then CMS would have 90 days in which to respond. So we stayed on top of them. When are you going to issue the corrected bulletin? When is the state plan amendment going to be filed? And it was radio silence for probably about a month. And then we were told that the state plan amendment was filed February the 5th. And they also said that they had an updated Pennsylvania bulletin that would be released on February the 24th. So we also said to them, have the MCOs been notified? Have nursing homes been notified? Trying to make sure that everybody along the healthcare continuum that you all deal with would be notified. So there are contracts that have to be reevaluated with nursing homes, with the EMS agencies that have contracts. And so the Pennsylvania Bulletin was issued on February the 24th. And so what I did was, as I started down this rabbit hole, I thought, okay, this is great. we've got these great rates. Where do we sit as far as in the country? Are we now the highest reimbursement level for medical assistance? So the American Ambulance Association, that the AAP is a member of, does a survey every year to see what the medical assistance rates are across the country. So, mileage, we are paid $13.20 per mile for each loaded mile. The one that comes close is Maine. Maine gets $13.20 a mile, but only for the first 17 miles. So, AO426, which is Advanced Life Support Non-Emergent, Arizona is higher than us. Advanced Life Support Level 1 Emergency, we are the highest. BLS Non-Emergent, Arizona beats us. Basic Life Support Emergency, we are the highest. AIR got a nice bump this year. They didn't pay any high-priced lobbyists, even though the language says ground ambulance, they also got an increase, so unintended consequence, good for the air ambulances. Advanced Life Support Level 2, we are the highest. And Specialty Care Transport, Oregon beats us. So while we have this great rate, we are not the highest. It is a huge benefit for us. However, we're not done. So that is a little bit of if you are a member of the Ambulance Association, I know we have municipal leaders here, we have state legislators here and their staff also, and probably some federal, but this is not enough. So when you're looking at EMS, if you think about it as a three-legged stool, you've got three legs that are balancing. You've got reimbursement, you've got workforce, and you've got sustainable funding. If those three are not stable, EMS is faltering. So we did get this nice increase with medical assistance. However, it doesn't cover the cost. There were GAO reports in 2007 and 2013 that said Medicare does not cover the cost. It's 6 to 17% below cost. And that was in 2007 and 2013. So you can imagine where we are now. Medicare has the ground ambulance data collection. If you're not participating in that, you should be, because if you don't, there's consequences. And we can have conversations about that. They are also a ground ambulance patient billing committee that is looking at the No Surprises Act, which carved out ground ambulance temporarily, but they're looking at ways to pull us in. So, when you're looking at that three-legged stool, the reimbursement level isn't quite enough. Workforce, we are struggling, really struggling. And then you're looking at sustainable funding. So while Medicare and medical assistance are now reimbursing at a decent rate, it still doesn't cover the cost. So it's not enough, and that is when you provide a service. What about when you're in the ambulance station, you are not out on a call, you have no revenue coming in, you can't sustain that. Does that make sense? Okay. So, our legislative agenda, skip all my big papers here. So we're not done with medical assistance. The rules and regs for medical assistance for our reimbursement still include VASC certification. And I asked you what VASC was, I told you when it went away, and look where we are. This is 2024. It's crazy. We have even taken the regulations, we have redlined everything that is outdated, inserted everything that is applicable for Act 37 that would keep us in compliance, and handed it to them, and they still won't change it. So that is still on our legislative agenda. I know that there's issues with audits. They have ALS audits that they are taking back the money. It is beyond the timely filing to file for BLS, so you're basically losing that money. We are aware of that. Let's see. We would like an ambulance inflation factor tied to medical assistance, so we don't have to come back and beg the legislature to give us another increase. So that is on the agenda also. Sustainable funding. We are looking for non-optional sustainable funding for EMS. There are pieces of legislation, there are accounting authorities, there are other pieces of legislation that we are working on. We will support, and the AAP, this is kind of what we have talked about at all of our board meetings, is we will support any money that goes directly to the EMS agency so they can continue to provide EMS. EMS is an essential service. We should be acknowledged, promoted, and supported as an essential service as we are defined in Act 37, which is the EMS Act from 2009, and Act 7, 8, 9, and 31 of 2028. I would say 2028, it might be 2027, but anyway. So we are an essential service. We should be supported as such. And that continues to be our mantra when we talk to the legislators. So retention, recruitment, and workforce development. We have some exciting projects. We are working with the Department of Labor and Industry on an EMT apprentice program that we would like to take statewide. So there will be more information coming out about that. We have had several workforce solutions and challenges meetings where we have actually sat down with all the regional councils. We have sat down with PEHSC, the Bureau is there, several EMS agencies are represented, and we are talking about all these issues, trying to come up with ways to have more solutions. We talked about solutions. You suggested solutions. We've got some solutions. More to come on those. We are also investigating a statewide fee schedule. We are fighting with the insurers all the time. Direct pay comes up every legislative session. And so we have a meeting coming up with Representative Cooper coming up in April. We have had some reach out from the Senate side, from Senator Muth's office with direct pay. There are other states that have fee schedules that are 325% of Medicare or more. Yes. So all of those examples, we will be sharing with the legislators as we continue to I think I need more coffee. As we continue to search for solutions. So the community health plans, community health choices, that is a medical assistance program. And what we have found is that they wanted to keep a lot of patients in their homes rather than in facilities. And many of those patients require bariatric stretchers. They require a little bit extra. Can you get into the house? Can you get the patient out safely? So because it is a medical assistance program and medical assistance is state, we can reach out to them because there are other states that pay for extra attendance. They pay for oxygen, they pay for some supplies, they pay for wait times. And so I was able to get that with that document that I got from the American Ambulance Association. So we would like the state to add those in. More to follow on that. So, as we investigate the statewide fee schedule, we're also investigating reimbursement for paramedic intercept as a statutory mandate of bundling billing agreements between BLS and ALS. And there are issues across the state where you have a BLS agency that has an ALS intercept, and so the BLS invoices, reimburses, or sends the claim in for it, and the reimbursement comes to the BLS agency. They don't share the ALS portion. So without a contract in place, there's really nothing that they can do. So we are investigating some of that too. Investigating the elimination of medical co-pays. So imagine with the emergencies, if you didn't have to chase down that copay, how great would that be? So one of the insurers comments to us when we talk to them about a statewide fee schedule, direct pay, they don't want us to balance bill. And so our comeback is, then pay us a decent rate. Give us compensation. Instead of thinking about it as reimbursement, you provide a service, you have these expenses, you get reimbursed. There's no money for raises, there's no money for equipment, there's no money for technology. So think about it as compensation. You should be compensated. So sustainable funding, reimbursement, compensation, and workforce. That three-legged stool that's very wobbly at the moment, we are doing our best to try and even it out a little bit. So, one of the other issues, I mean, that is our legislative agenda, but in the meantime, there's legislation that comes down the pipe that we have to be aware of. the grant reauthorization for fire and EMS. That is in need of reauthorization before June the 30th. So we had a meeting in January, and we talked about the grant reauthorization, which is wonderful. However, the governor was in Altoona at West End Ambulance, and he said, I'm giving $30 million to EMS. I'm giving $30 million to first responders. So he wasn't really clear where it was coming from. So I reached out to the Senate staffers that we had just had a meeting with on the grant reauthorization bill, and I said, if they're gonna infuse $30 million into the fire and EMS grant, EMS would like parity, because fire gets 87% of the grant. No offense to fire-based EMS, EMS gets 12%. If he infuses $30 million and makes it a $60 million grant and EMS gets 12%, that is not fair. It is not fair. And we don't want to take anything away from fire. I mean, you know, fire needs the money too. EMS needs the money too. We're all essential services. However, I have reached out to Tom Cook, the fire commissioner. I have reached out, we had a meeting with the House and Senate Veterans Affairs and Emergency Preparedness Committee staff, PFESI, which is the Fire and Emergency Services Institute, and some of the other fire organizations, and I said specifically, we would like parity, and they understand. So we've got a two-pronged approach here. We don't know if it's gonna be included in the budget. The grant does need to be reauthorized. There is that formula in the legislation. So if we do get that $30 million, we have to figure out how we can get parity. So Tom Cook is aware of it. Legislative staff is aware of it. So that is something that isn't on our legislative agenda, but the minute that I saw that press release come out, it was like, oh, no. We need parity, we need help. So, in 2025, there will be 12 or more legislators who are not seeking re-election, which means more education needs to be done. So for the 18 years that I have been working for the association, I keep saying we need to educate, we need to educate, we need to educate, we need to educate, and we do. We absolutely do. So that is our legislative agenda. That was kind of down the rabbit hole history, because it's kind of, I'm such a nerd. It's interesting to see where we've been. $20 in 1978, and now we're up to Medicare. It hasn't been easy. It was a hard fight, but it is definitely worth it, and we are not done. So, May 13th and May 14th, for the EMS providers in the room, we will be having our reimbursement conference. I'm gonna do a little bit of plug here. It is at the Hershey Lodge. There are issues coming down the pike. OSHA has some proposed rules. The deadline for comments is May the 5th. Scott Moore from Moore Consulting is going to be coming and talking about the proposed rule and what you need to know for your EMS agency. And then, I thank you for giving me the opportunity to talk about this success. I could go on and on about this. I am very proud to work for this organization. We have done an awful lot of work. I have board members. I wish they were here. I really do wish they were here, because it's funny, because I tell them, I need an answer now. They give me cost, they give me information, they give me details. The things that I need to help move things along, they are always there for. So if you know who your board member is, or if you don't, let me know. You can always reach out to them. You can reach out to me, talk about the issues that are affecting you, and I would be happy to answer any questions. All right. I do thank you very kindly for your attention and for hearing me.